Hello and welcome to the Multicultural Media Online Conference hosted by the Ministry of Health, Multicultural Health Communication Service with the support of Multicultural New South Wales. I'm Jesusa Helaratne, Deputy Director of the Multicultural Health Communication Service, and I'm your moderator for this session. Thank you very much again for joining us. Today, we are joined by two special guests, friends of the Multicultural Health Communication Service and New South Wales Health, Ministry of Health, Tish Bruce, Executive Director of Health and Social Policy Branch at the Ministry of Health, and Dr. Palu Malaowalla, Community Leader and General Practitioner, who will discuss the LGBTIQ plus health and women's health ahead of the Sydney Gay and Lesbian Mardi Gras, which started on the 16th of February this year and will run until Sunday, March 3rd. And also International Women's Day, which is March 8th. And March is a very big month. So we've got a lot to talk about. Tish and Palu, thank you so much for joining us.
Pleasure.
I would like to begin by acknowledging the traditional owners and custodians of the land from which we are all meeting from today. Tish and Dr. Palu are joined, and our team from the Ministry of Health and MHCS are joining from the land of the Camaragill people of the Eora Nation. We pay our respects to elders past, present, and emerging, and pay respect to Aboriginal elders and colleagues who may be joining our session today. We also pay respect to colleagues and multicultural communities who are represented in this session. We will do our best to answer all your questions, but please, as we've done before, please keep your microphones on mute, but please put your discussion points or questions onto the chat because we have Tish and Dr. Palu to answer your questions. So we shall begin. As we said, March is a big month with the annual Mardi Gras Parade and International Women's Day, providing important opportunities to reflect on and celebrate the different parts of our community. And ahead of Mardi Gras Parade this weekend, International Women's Day, which we said 8th of March. We're pleased to share so much information to all of you today. And Tish, thank you so much for joining us. In New South Wales Health, we have taken on this very important strategy, and there's an interest in the LGBTIQ health and women's health, and with distinct strategies, frameworks. Could you discuss a bit about that?
Thank you. So we know that there's lots of women and LGBTI plus people across New South Wales who experience good health and well-being, but there are particular needs for both of these communities in their health and well-being. And it's really important for us as a health service to actually be aware of those needs and to understand what the different communities are needing and at different points of times in their lives as well. So through our work of working with communities and understanding them, looking at research and evidence, we try to actually look at what were the things that we can do together to actually ensure that people get the best health and wellbeing outcomes for themselves, that the things that we do actually matter to them, that it makes sense, the work that we're doing, that they're engaged in the healthcare that they're receiving and in a way that they can that makes sense to them and in their times of life, but also that we support our staff as well so that they can really confidently engage, that they know what skills and that they need to bring to the table, they've got knowledge about the needs, and that they can then adapt the healthcare they're providing to the individual that they're meeting in front of them. So we've got a couple of strategies in that space. And did you want me to go to the strategies or the challenges, or where would you like me to go?
Definitely go with the strategies, with the challenges and why we've come up with these strategies to face them.
Yeah. So the two groups, there's some challenges that are overlapping for the groups. Obviously, the groups themselves also overlap, but there are specific things to the particular groups themselves. So if we think around the LGBTIQ plus community, there's particular challenges around mental health and emotional distress. And these are there for a whole range of reasons. There's like both historic and current trauma, distress, stigma, violence, all sorts of things that people are experiencing in their backgrounds for themselves personally, but also for other people within their community. And so that can add a whole layer of anxiety, background pressures to them that impacts on mental health and well-being. There can be greater exposure to violence, abuse and neglect for people from LGBTIQ plus backgrounds. There are, for some people, they experience harmful patterns of drug and alcohol and other drugs of other use. And there are particular issues for communities for trans and gender diverse people and for people who have innate sex differences. So those two particular groups have additional health needs and interests that we need to support. For women, and again, noting that women overlap into our LGBTIQ plus space, but have needs that are just about being women. And so they can be in the spaces of sexual and reproductive health, things around mental health as well, but in different ways and overlapping ways. But there's also things in terms of chronic disease, that the expression of chronic disease and the treatment of chronic disease can be different for women. And so being aware of that, because we often took a lot of our research from studies around men, and particularly around white men. And so it's taken quite a time for us to really understand that both how disease presents for women and what we need to do to treat women and care for them well is different than the usual, and that's important so that it's effective care for those women. And then also how we relate to health promotion activities and education.
Thank you so much, Tish. And if you have any questions, please put them on the chat, any comments, and we will be sharing some links to some strategies and information that may be useful for you. But Dr. Palu, with women and the LGBTIQ plus communities, there are multicultural communities and diverse communities that identify in this space. So as a GP, as a general practitioner and a health professional, what's your advice, especially with going for healthcare and support, especially mental health and also the issues that stand with them with stigma and discrimination?
Yeah, so like Tish was saying, there's so many things that come with it. The mental health problems, the drug and abuse, alcohol abuse, they've been through the violence and, that sort of, affects them. But the main thing in these culturally diverse communities are the family does not accept them. So that's a big issue, and they feel so isolated because family is a big thing in culturally diverse people. And so that is where I think as GPs we come in, because we need to actually get them together and say, look, this is not something abnormal. It's a person. You have to make sure that you treat him as another person. He's your son or he's your daughter. And, she's your daughter. You have to look at all aspects and help us out with trying to fulfill the needs, mental and physical needs of this person. So that's where I feel very bad, And there are now social groups coming up in the community where they're supporting each other. And but that was not there before. Even as doctors, in my medical director, where we have this software, it was only male or female. You can only tick one box. And now it comes up as other, and then you have all these, other groups of, transgender and all that stuff. So it's only now that we are actually learning more. I think the doctors need to be taught a lot more as well as health professionals. So we can do a better job with them. And the programs that you people do, Tish, I mean, I think that's amazing. So you are going to send those links in the chat box, right?
Yeah, absolutely. Yes. We'll send it to you. We'll pass it on to you.
Okay.
And yeah, Dr. Palu, and thank you so much for that information. But that's why the strategies are here. It's systematic change is happening. That's interesting. Now, before it was just these options, but now there are other options. And it's about education and awareness.
It absolutely is about education and awareness. And I think we have moved a long way over time. We've got lots further to do. But if I think I've had the privilege of being able to work both at a local health district level, in clinical services, delivering clinical services myself, and now working at a statewide level. And I think in all of those spaces, we can affect change and we can support people to experience care differently. So when we're as an individual clinician and in front of a person, it's absolutely what you're talking about understanding the background to that person and the whole of the person, their history that they've gone through, and that can be affected by where they've come from and whether they're refugees, whether there's been trauma backgrounds, those sorts of things. But also what's important for them and what resources are out there. When we're looking at a district level, we can look at how do we organise our services together and get best best understanding across multiple places that people touch our systems and be able to kind of meet them wherever they are engaging in our systems, and we can see them through that, and we can make most effective and use of the resources we've got. And coming into the ministry, for me, it's been an amazing privilege to do this, because we can actually take those learnings from working with local communities, local projects that have been amazing. And, you know, we'll talk later about Pink Sari, where you just do absolute ground roots things driven by the people in a local community responding to a need that then becomes bigger. But then once you come to the ministry, we have an opportunity to amplify that across the whole of the state, and look at how do we then set funding, policy, strategy, programs, things that can impact so much more broadly, but that we can learn from those local things. So it's never a one size fits all. Like all people are different, all communities are different. So our strategies need to set for us the directions, the intent, the platform to go, we can do more and better. And then we make that local through the districts, the services, the providers, and everybody doing that.
And I guess from Palu's point of view, where the direction is really important from how we set the pace for the future.
Right, correct. So, look, as a GP, I've been here as a GP here for 25 years or more. And I've seen a lot of people suffering because of there were not enough programs, or, you know, they didn't know where to approach or what to do. But nowadays, I think we give them a lot of resources, and they're all in their languages as well. Same culturally diverse, people.
Yeah.
They have their own pamphlets, their own language, because language is a big barrier, especially for people of culturally diverse background. And of course, there are other issues which we can talk about later on, especially for women. Yeah.
And for women, and Tish, one of the things of with the strategy for the LGBTIQ plus communities, there are also that falls into the plan of the culturally and diverse communities as well.
Yeah. So one of the things we try to look at is where are all the different intersections. So we could write strategies that only speak to one population, but as we say, no one fits in one group. People sit across multiple groups. So whenever we're looking at the development of a strategy and the way we want to drive things, we look to see how does that play out for different communities. So it's interesting that both in our LGBTIQ plus strategy, we actually call out core communities as a particular focus area that have overlapping, but again, specific and different needs. And we need to think again in that way of what's needed for all, but what's needed for particular groups of people. And then similarly in the women's strategy, we do the same. We look at the populations that are affected differently, and culturally and linguistically diverse groups come out in that as well, as do refugee and asylum seeker people and LGBTI plus people. So it's kind of, and I think that's one of the ways across New South Wales that we try to strengthen things, is that it's like from whatever lens you're coming to, think about how that plays out for different and diverse communities. And then we're always going to be meeting or stepping towards the needs of the individual that's in front of us.
And one example of that is a program from the New South Wales Service for Treatment and Rehabilitation of Torture and Trauma Survivors, or STARTS. That's a great program that they're doing.
Oh, look, the STARTS are an amazing group of people. So you know, they've got a focused population, but we had the opportunity to do a startup funding for about $2 million across the state, and invited people from services, predominantly from New South Wales Health, but also from our NGO partners, to look at things that they could do to strengthen supports for LGBTI plus Q plus people, but also have lenses around things like torture and trauma and refugee backgrounds, or multicultural backgrounds more broadly in other areas. So STARTS has picked up a lovely project that they're actually looking at what are those intersecting needs, because I think there's very limited, it comes back to your point before, there's so many areas we have very limited knowledge about, and they're building the knowledge in that space and then building the training and education that will support providers to actually act in a more informed way that actually helps the outcomes for people.
Yes, and so we'll put that link to the STARTS program as well onto the website. Again, if you have any questions, please let us know and put it on the chat. Especially, and we have really good experts here today. Now, Dr. Palu, turning on to you about Women's International Day, which is in this coming March, and I just have to take note that in 2014, 10 years ago, we had filmed Dr. Palu as the first community champion for the Pingsari project to talk about breast screening and to raise screening rates for South Asian women, Indian and Sri Lankan and South Asian women. And you were the first to come out because it was important to talk about it, but a lot of people didn't want to talk about breast screening or screening rates. And that is really important to highlight that sometimes it takes one step at a time to become an example, and so for people to follow.
Correct, yes. So people don't like doing that because, they don't want sympathy and they think that, let me deal with it myself. And, it's a social stigma. If I've got breast cancer, people won't, they'll talk about me as not complete or whatever that stigma is. And also there are mental health issues where they want to withdraw within their shell. So, not trying to take more support from outside. So all that. So I'm glad I did it because it made me feel more confident. And, I'm glad I'm helping so many people. And many of my patients also look at the video and come to me and say, oh, you've been through that. Now, can you tell us more about it? So,
Yeah, it takes just one example. As a breast cancer survivor, yourself as a GP and dealing with a lot of women, what are the services that people can take up and be able to just be open to be able to discuss their health issues?
Yeah, so discussing the health issues, but I mean, look, women have a lot of other health issues, right? But when it comes to women with culturally diverse, we've got more issues, yeah. Because you've got, like you said, a social stigma, you've got lack of awareness, you've got that sort of thing, that mental thinking that if it's not broken, don't fix it, that is the type of thing that we look at. So if they say, there's nothing wrong, why do you want to do a pap smear? Why do you want to do a breast check, So these sort of things. And also there are people who are busy, they've come from other issues, they are both working, husband and wife. And they should find the time, the money sometimes, because GPs now don't all bulk bill. Because there are so many other things that we need to look at. But if it wasn't for this breast cancer screening program, I don't know what I would have done, because it was because of that where I couldn't find a lump. I couldn't find anything. It was just a routine check that we did. And the breast screening normally starts between 50 and 70. But at the age of 40, you can actually ask them and you can ring up and make that appointment and get an appointment every 2 years for it. So I really think it should start at 40 rather than 50. But there are other programs like this pap smear register that they've done. They inform the women. I think it's amazing because we follow up, but sometimes we miss it and they get these letters from the cancer screening people. And, so that's another program that I think it's done well.
Thank you, Dr. Palu. And that is part of the strategy for the women's health in what we're trying to do is that New South Wales Health is trying to take a lead on.
Oh, absolutely. And the women's health strategy, and sorry, I know you just asked me a question, but I was thinking about something that you were talking about. And I think one of the beautiful things that came out of the Pingsari project, there was two parts of that I think are worth sort of potentially picking up on. One is that we started from a knowledge that the communities weren't particularly comfortable talking about cancer, but the strategies that have been put in place to actually engage that conversation weren't working particularly well. So in the district that sort of funded this work, they went, let's try different and ask communities themselves how to engage with their own communities and what the things are that matter. And so there was a couple of projects at the time that weren't designed by the health system, but were designed by the communities themselves. And I think that's really powerful that you actually are, the people you're speaking to are part of the design of what needs to happen. Co-design, as we now know it. And I think the other thing that picks up on is because we can sometimes talk about all the problems and issues, But it actually goes to the strengths. There's so much strength in communities as they come together around supporting each other and actually moving forward. And I think we both need to pick up what are the areas of needs, but how do we actually play on, work with the strengths of individuals and communities so that we move forward, not from a kind of what's called a deficit model, but actually about something that's strong. So shall I go back to your question? Because I diverted from you. You said I'm
No,
allowed
but
to
it
do.
was really fantastic. It really is about that, so that it highlights what work is needed.
Yeah, because none of us hold these answers ourselves, and there's no one right way, and what's right now is not necessarily right in the future, but that we keep building on the learnings over time. So I think we do have the two great policies out there. The women's health policy that we wrote in 2019 goes through till 2023. So it's due for us to have a look at again. But it really it picks up on the things across the life course for women. Often women were thought of only as women's health needs in terms of their reproductive status, what's happening with our ovaries and other parts. And actually women's health and well-being is across the life course. We need to think about all the different stages that women go through, whether that's, through our fertility time, moving through childhood into womanhood, things around endometriosis, menopause, as we said, chronic disease, but also how that fits in the lives of women. So the Women's Health Strategy tries to pick that up about all the different important aspects of being a woman across that life course and how women best engage with that, with some real focused areas around mental health, obviously around mental health and reproductive health and those sorts of areas, but not limiting to that, which is I think where women were limited to before. We were only seen as that. So it says it's actually our whole life that's important as we look at it as strategy.
It's the health journey, isn't
It's
it?
the health journey. And and that change, there are specific issues even as we go through old age and through towards death. There are different issues for women than men in those spaces. So there's important issues for whole of society that we do for everybody. And then again, we look at the person in front of us, and then we look at the rest of them, which is whether they're coming from a cold background, things, if we're going to stuff around death and dying, there's different value sets in that. So we bring all of that together in front of the person.
That's correct. And also women's health, there are important messages there, not for the communities, because you have a mother, you have a sister, you have an auntie, you have so I think it is important for messaging across the board of what can you do to encourage the women in your lives to go for health checks. And Dr. Palu, as a GP, as a breast cancer survivor, you're more than aware of how important the services are for women. And what are these services?
So you've got these, mammogram screens that you do, once every 2 years from the age of 40 or 50 onwards up to the age of 70, 75. So then you've got these the cervical screening tests that you've got now. It's a different test altogether, but once every 5 years, not a difficult test at all. You can actually do it yourself. So, if people are shy, people who don't want to get it done, we can also give them that service. Also, there's all these other ones too, the bowel cancer one, which is for everybody. So, sexual health, like from community centers, you've got sexual health centers, you've got mental health centers, you've got a lot of services now, so for women to access. But the problem is that many people don't know how to navigate through that. So we are the first point of contact, and that's what we have to do for them.
Yeah, and I think also for young women, for you said the journey, it starts at a very young age. And how can you kind of prepare young women to be in the habit of getting tested? And that is part of the services and the commitment to promote this.
Yeah, absolutely. And look, and it starts right from the beginning. And there's one of the ways we think in our space, which is quite outside of this, but in our Brighter Beginnings early years space, where we're looking from, preconception through to 5, is that what we're laying down in our early years and experiences actually affects us later in life and affects us through our next generations and the children that we have beyond, this generation into the next ones. So laying down good health behaviours and practices is incredibly important. And we started through vaccination programs when kids are young, looking at healthy weight and body image and responses around those sorts of things. As we go into adolescence, adolescence can be a really tricky time for all young people in how they engage with healthcare, because then transitioning from being a child and dependent on their parents for that to taking responsibility, and often it's a time when you don't want to actually take on those responsibilities. Things that is coming up around vaping and those sorts of things that have long-term life impacts. So what we do in our health in youth is incredibly important. But then how we think again about fertility, all sorts of care things, but as our role as parents, if we become parents, as carers of other people, and looking after the health of women themselves, like women looking after their health. And as you say, I think families supporting, or you were saying families actually supporting women to look after their health, actually supports them both in themselves, but also in how they then sit within community and stuff like that. And we know women, like both men and women, can, for different reasons, not look after their health. And women often do it because they're putting aside their own health needs for the health needs of other people. So ensuring that women actually prioritise those health screens, because they work and they matter. And we know that we can do so much more when we pick things up early than when we pick things up late. So prioritising that and supporting women to say, actually, that's important. It's important to us as well as to you when we're talking about them as a part of family and community.
Yes, and it is important also to note that, there are services to support people who need language support. So there are healthcare interpreter services that doctors do, and also translation service. But a lot of people don't. You said that it is important to teach doctors and GPs and health professionals as well as the community.
That's absolutely right. Because as GPs, you know most of your job, but when it comes to these sort of things, you do need more education. And this changes every day, because the needs, it's not just one. You don't just say, okay, it's a transgender. There are so many different aspects to it, and knowing about each one of them is important, because everybody's needs are different. So, and how to deal with them, how to talk to them about the infection control, how to talk to them about the mental health issues, domestic violence, so you need to know the whole story.
And I guess my question to you, Palu, as well, is doctors need support as well.
Correct, absolutely. And we have these, that's why I want those links as well. And but there are so many other projects and supports that we can help. But I do I with especially women, like I do ask them to contact Pink Sari programs. I do ask them to for whatever health issues. There are many other community forums that are there, and I do ask them to contact them, because what is important is you feel that you're not isolated. There are other people like you in the community. So yeah.
And going back to your advocacy for Pink Sari, I know that there are lots of community events, and that means connecting with people that is from your cultural background, who have that language support, and also being connected to doctors that could support you for those sessions.
And so the Pink Sari people, I'm one of the people who help them out, but the main people there are about 4 or 5 of them, and they do a lot of community programs, and they call people in and make them aware, and they call doctors in to give, so whatever questions they have, rather than they can't just go and ask anybody, but within they come with friends. So the friends also talk, and they feel more comfortable talking to, in that forum. So I think that's very important. It's a great job they're doing.
Yeah, so Pink Sari is one organization, but there are so many other community organizations around that cater to seniors from the multicultural communities. And that is what you were saying, is co-designing and working together, Tish, so that the framework and the platforms that we continue to do work.
Absolutely. And look, and picking up another beautiful project that Starts is doing, they've got a peer-led project, and I'll get the name right. It's a Walk On, Walk Strong. And that's again looking at LGBTIQ plus and multicultural background people, that's sitting with people who have lived experience. So it's your thing of people feeling like they're not walking alone and they're able to talk to people that know what they're going through and actually can support them through that. Into Sydney LHD's project that was came up through the enhancement funding is actually building on the training for clinicians, but also for interpreters. So we were talking the importance of being able to have people speak in your own language, but we actually need to support our interpreters themselves to understand all of these issues, so that as they're working on that. So and then that places people back in, being able to be comfortable and confident in there. So I think I think we're going to provide a whole range of links of things, and I can pull up some as we're talking in a minute, of the breadth of range. And I think if I find it in a moment, there's a really lovely website that it might be called Rainbow Links. I'll just check that, that you can go onto, and actually gives you a whole lot of support groups and connections to other services and providers that pick up also on called communities.
Well, look, we've run out of time.
Oh my God.
It's 30 minutes has just passed by, but there are so many things to discuss in these topics of LGBTIQ plus and also women's health. But this is just the start of a conversation. I think it is up to the communities to continue that conversation. But if there are any last words, what are your words to the health workers, to the multicultural media friends that we have online, and for them to deliver messages?
Look, I think starting off by going happy Mardi Gras and happy International Women's Day. And I think that the work that we do and how we engage with individuals and communities absolutely makes a difference. Like, it makes a difference to the person in front of us. As we said, it makes a difference over lifetimes, and supporting people to support their own health, but also being there to walk with them, find pathways through, look at what the gaps are, be responsive to go, if my service is not the right service, working the right way, how do I adapt it? But also for people engaging with services, if it's not meeting your need, keep asking questions, see what else is out there. We will put up links on the website of a whole lot of places that you can go to for information and resources. And there is stuff out there in a lot of places. There's still gaps, but there's a lot more than there used to be out there. So I encourage you to use it all, talk to each other, talk to your general practitioner. We've got women's health centres. We've got 20 of them across the state. So they're a great place to go to as well, and some fabulous NGOs.
Thank you so much, Tish, for joining us today. And Dr. Palu, who's GP as well as a former president of the Australian Indian Medical Graduates Association. Thank you so much for joining us. Any last words for the community, the health workers, as well as the media?
Yes, just in the community. I mean, each person can do their bit. So if you can just collect your friends around you, have a walking group, have a library, have a book club, whatever, and talk about health issues, talk about and that's the best place to actually communicate and get a good health outcome.
Thank you so much, Palu and Tish. Palu, thank you so much for joining us. And as we said, it was like a conversation with friends, but also with lots of information. And I hope that the list of services and the advice that's been provided to you has been helpful. There will be links in the recording that will be sent through email to you and your communities for you to share with your networks. But thank you again for joining us, and we hope to see you again in the next fortnight. If there are other topics that you'd like us to feature, please let us know. The recording will be on the New South Wales Multicultural Health Communication Service website. Meantime, have a great day and take care of your health.